everybody, this is Azar, physical therapist. Today I want to talk about the subject that you have been waiting for it for a long time, I know, because it's a most common problems that people go to the physical therapy for, which is low back pain. The pain in the lower back area, which is very annoying. It can be caused by lifting heavy stuff or wrong body mechanic, the jobs that are demanding so much sitting, so much standing, or lifting heavy stuff improperly. So some of us, we experience that ouch pain when we try to lift heavy stuff and it stayed with us for a long time. Some of us had a motor vehicle accident, so we started having some pain and tightness low in the lower back area. Some of us, we experience the curvature that is more than normal curved up. So some of us, we experience the weakness of the abdominal muscles or the buttocks muscles, that core area. They all can cause lower back issue. It's like a cycle. Weak or imbalanced muscles or some tight muscles can cause low back pain. And low back pain because of having a spasm of the muscle, spasm that caused by pain, can cause again the problems in the muscles and decrease the balance of the muscles. So it's like a vicious cycle. It goes back and forth. So we have to have a normal curvature, good posture, and normal muscle tone in both sides of our spine, front and back especially, and the buttocks area and the abdomen, to be able to have a good and functional lower back, which can help us with sport, with the work, with everything in the life. So I want to introduce you to the curvature of the spine real quick. So we have the lumbar curvature. We all know that lumbar is having a normal lordosis. And as you can see, that's a normal and that's abnormal lordosis right here. So normal, abnormal. So hyperlordosis is one of the very common problems that can happen when people have balance issue on the muscles or postural issues. Some people have it genetically, some people because of the looseness of the abdominal muscle or tightness of the paraspinal muscles. So I want to talk about another thing, which is a pelvic tilt. Pelvic tilt, you might be familiar with it if you have done Pilates or other exercises that they teach a lot of body mechanic and body awareness, and most of us, we don't know about that. That's the pelvis bone right here. That's a neutral position right there, okay? The pelvis has to be in the position that's not too much anteriorly rotated, not too much posteriorly rotated. I'm going to show you in my pelvis too in a minute. So that's the pelvis that's posteriorly rotated. So as you can see, the arrow shows that pelvis is rotated backwards. That's anteriorly rotated. Okay, pelvis that rotated forward. They both wrong. And a lot of us have this issue because of imbalance problems on the muscles. So I'm going to show you in my body real quick. Hopefully we can see that. For seeing the pelvis tilt, you have to put your finger in the front of your bone, the hip bone, and another finger in the back of your pelvis, okay? And then what we can do, we can imagine we're rotating that bone, the pelvis bone upward like this. As you can see, my thumb and my index finger, they have a different angle than normal right now. We call it posterior pelvic tilt. When I do that, my back gets flattened, okay? And then that's normal. So you see the position of my thumb and my index or third finger. And that's the anterior pelvic tilt, which can cause too much lordosis. You see that? My pelvis is looking down. So anterior causing too much lordosis, normal cause normal lordosis, and posterior pelvic tilt causes flat back, okay? So all of us, we have problems in somehow in the pelvic tilt, which can cause issues. So people with anterior pelvic tilt, first of all, they are the people that get hyperlordosis right here, that problem, okay? And that usually cause hip flexors in the front to be tight. Imagine when your pelvis tilted forward, what happens in that these two muscles, two of my hands are hip flexor muscles attaching right here. They get really tight. So what we can do for that? Very easy. We have to tilt posteriorly. So that's a very easy solution. And sometimes this muscle gets too tight for some runners or people that you overuse that rectus femoris muscle. The way that they really cannot get rid of the tightness other than a lot of stretching, they need to do a lot of hip flexor stretch, which we're gonna go over. Another thing that can cause anterior pelvic tilt is too much tightness in the paraspinal muscles in the back. So imagine if they are really tight in here, they can cause a lot of lordosis, and that can be a problem. Another thing that can cause hyperlordosis, which is the most common problems, too much curvature in the back, which is weakness of the lower abdominal muscle. We have the muscles, we call it lower abdominal, and the most famous muscle in that group is TA or transverse abdominal. You may not be familiar with that muscle, but this is very important muscle acting as a back brace in your body. So you basically have a natural back brace, which is a transverse abdominal muscle, goes low from here, attaches back to the lower spine, protecting your whole lower spine, but you don't know that you have it. A lot of you don't know how to activate that. Research shows that a lot of people lifting heavy stuff without activating that back brace. Imagine when people go to the gym, try to lift heavy, they have back brace on. When we have a natural back brace, what we need to do, we need to just connect it with our brain to activate that lower abdominal muscle while we're lifting stuff to have a healthy back. So that's very important, and a lot of us ignore that and don't know about this important muscle that can get activated to protect our back while we lift heavy stuff during their daily life. Some of us be born with that. Research shows that some people don't have that connection. They're born with that, not connecting these muscles to the brain. So we have to build that connection by strengthening that transverse abdominal, doing Pilates, doing core stuff, core strengthening exercises to activate that. Another group of the muscles that I want to tell you about is upper abdominal. That famous rectus abdominis. You guys all love it, especially guys, athlete guys, six-pack, yes. This is not the muscle, surprisingly, that we really need to strengthen for lower back pain, okay? We need to sometimes relax that muscle because that can cause too much flexion of the spine and too much pressure on the disc. So this muscle is just for cosmetic. Most purpose of it is cosmetic reason. People go to the gym, they tell, oh, I want to have a good six-pack. Of course, it's beautiful, but it's not necessarily healthy for people that have lower back problem. They said, oh, I'm working on my abdominal muscle to get my back healthy. Yes, but that's not the muscle that we want to talk about. That the first muscle I told you, transverse abdominal, is the one that we want to strengthen to have a healthy back. I really wanted to spend this whole session for that difference between the superficial muscles of the abdomen and core muscles, for you to know how important the core muscles are for people with the lower back issue. So that's a must. So you need to know this muscle and difference of that with the six-pack to be able to treat your back successfully. I want to go over one quick exercise to show you how to activate that abdominal, lower abdominal muscle, and it's going to be laying down, okay? You can all lay down. Put your hand go from that bony prominent in your pelvis, okay? Go like 1 inch or 2 inside with both fingers. It's really low. You're gonna put your finger low, okay? And then what you're gonna do, you're gonna try to press this finger up to the ceiling with your belly muscles. So you're basically pressing your finger up towards your belly. You're not hollowing, okay? You're not hollowing in, you're pressing that muscle out. What happens during that motion, you automatically pushing your belly button towards the spine and towards the floor, and you pushing out to the ceiling your lower abdominal or transverse abdominal muscle, okay? You can hold it for a couple of seconds, relax. And while you're doing that, as you can see, if you put one hand here, you automatically going to posterior pelvic tilt, so you're flattening your back a little bit, okay? If you're a person that you have a flat back already, you want to prevent that. Just focus on pressing up, not to press your back to the table too much or to the floor too much, okay? If you're people with the flat back. If you're a person with the too much curvature, you want to do that pelvic tilt while you're strengthening that abdominal muscle. So you're going to press down with your back to this hand, and you're going to push up with your muscles, pushing up your finger to the ceiling, okay? Very easy exercise, very effective one. I hope you could use it, very important. I just wanted to spend this session to train you about your lower abdominal muscle. Thank you for watching, and I hope you have a healthy back. If you like our channel, you can subscribe and introduce the channel to your friends if they have any problems with the body or with the core strengthening. Please consult your physical therapist or your doctor before watching and performing any of these exercises in these videos. Thank you so much. Have a great day.